So good morning. You're on the East Coast, right?
I'm on East Coast, but wait, I'm confused. Are you still on the West Coast or are you now visiting the East Coast right now?
I'm visiting the East Coast right now. So I'm with my family here for the holidays. So yeah, I'm on the East Coast. So that's why when we scheduled this, it was kind of back and forth. So
Yeah, but it's still super early for you because when did you get in? Like, it's always so hard traveling from the West Coast to the East Coast for these morning meetings. So thank you for getting up early and doing that.
yeah, no, definitely. I'm super glad that we did this. And yeah, so thank you so much for hopping on and joining me with this IG Live. So how are you been doing? You doing okay with everything?
Doing good. So, hurricane, or it was actually a tropical storm, Ada, was
Mm,
just down because I live in Miami. And let me tell you, I've actually wanted to like stay in a condo. We live in a high rise in like
mhm.
downtownish area of Miami. And there's been other hurricanes that have come through. I'm like, oh, I can do it. I can ride it out, whatever. But I've never been in the middle of a hurricane. And I've lived in Florida for a long time.
Hmm.
But tropical storm Ada came through Sunday night and literally tropical storm, not very bad winds or whatever.
Hmm.
When I tell you the wind, the noise of the wind woke me up Sunday night a little bit before midnight. So going into Monday morning, I
Hmm.
was so glad my husband was home because I would have been so scared. It was
Mm.
like pounding the wind. Caw, caw. It
Yeah.
was horrifying. And I have friends who have been through hurricanes, and we live in a newer building, so we have hurricane impact windows. But do
Yeah.
you know what that means?
It's scary. The roof could just tear off. You don't know,
Right, but the hurricane impact, when things are built to code for hurricane, it means
Uh,
the buildings like sway and the glass like moves. It's fluid. It was crazy. I
yeah.
so that made me realize that I will never try and stay in a hurricane. There was a hurricane that happened like 3 years ago. This
Hmm.
is when I was still in medical sales. I was in Atlanta for a sales meeting and I was supposed to fly home, but the next day was when the hurricane was supposed to hit Miami.
Hmm.
And
Hmm.
my husband's like, Jackie, do not fly home, fly someplace else. Because my husband's a pilot. He's like, I can fly the UPS planes out of here. So I want to get out. But if you're here, then I have to worry about you and all this stuff. So I
Yeah.
literally stayed in Atlanta and then went to see an account in Oklahoma. So I didn't even come home for like a week
Yeah.
after, and it was pure devastation. So Ada is now getting ready to hit Jacksonville, but I don't know if you can see behind. It's like super cloudy and rainy and overcast, and
I
that's
do see
overlooking the
that.
bay. It's
Yeah,
crazy.
yeah, I do see that. I love Miami. It's been some time since I've actually, been there. But yeah, the Gulf is that's the that's a double-edged sword with the Gulf. It's like
Yes.
you get so many tropical storms, you don't know when it's going to hit, and you feel like you have to evacuate like all the time, right?
Yeah, it's kind of crazy, but I will be on the first plane out if there's ever anything that looks like it's going to hit here. And half the time it ends up moving, or like 90% of the time,
Yeah,
the path completely changes.
yeah,
So,
yeah, exactly. Well, it's good that your husband is a pilot, so you have first notice of like which way to go and when to go and stuff like that. So,
exact. No, it is kind of nice. It's so funny. So, I used to always say that orthopedic surgeons are like glorified like construction workers. And
right.
I say the same thing with my husband as a pilot. Like they basically have a degree in like
Hmm.
weather and everything too. So he gets all the like different inside information. So it is kind of interesting. But I have to say too, it's beautiful to watch the storms from my
Uh-huh.
car because we're right over the water and it's really pretty. But pretty, I will not beat out scared. So I will be on the first.
Yeah. Yeah. I mean, like you want to enjoy moments, right? So, you can't really enjoy moments if you die, right?
Exactly. And this is all actually a really good segue into what I wanted to talk to you about. Like right now, it's flu season. So flu season is bad enough in and of itself, but there's also ways that we can protect ourselves from getting sick and whatever. But we also now have COVID numbers rising, and you are super active in the medical community. You see patients too, right?
Hmm.
And what are some of your tips to stay active and help protect your health during
Yeah.
the season?
Yeah. Well, before I answer that, let us introduce each other to each other's audiences. So, for, Jackie and her audience of the Plant Chicks, I'm Colin Zhu, Dr. Colin Zhu, and I know Jackie and Marcia from, man, how many years has it been? Like at least like a couple or something like
A
that?
couple, yeah.
Yeah, and I've met these guys in the lifestyle conference, and what I remember my first impressions are is that they're super, super nice, super approachable, a lot of energy. And when I see you guys on social media and doing your thing, it definitely you still emanate that, in person. And so to me, that speaks authenticity and living your not just yourself, but also your brand and what you guys are passionate about. And I also host a podcast, and you guys were, very, I was really happy to have you guys hop on as well. So I'm glad that we're doing this. So
Awesome. And thank you for your introduction. I want to give you some shout outs too. We love your podcast. So if any of our followers, if you guys are not following Colin, please make sure you're following him and definitely check out his podcast. He's got so many incredible episodes and it's called The Chef Doc, right?
the podcast called
Thrive
Thrive Bites.
Bites.
Yeah, Thrive Bites. Yeah.
I knew that. I knew that. Thrive Bites. I said it at the same time as you. I really did know it. No, but you guys have to listen to his podcast. He's got really, really great episodes. And for those of you who don't know me, I'm Jackie, co-founder of Plant Chicks. I'm a registered dietitian by training. I'm also a certified well coach. And Marcia and I met. Marcia is a personal trainer. She has won numerous, numerous awards in physical fitness and training bikini competitions. And she also has her Cornell plant-based nutrition certification. But I met her because she trained me online to do a fitness competition. And
Hmm.
it was the most amazing experience. It was super, super, super amazing. And that is the time. And even as a dietitian, I would always tell people that nutrition is like 80% of the game. Like people want these ideal bodies or whatever. But it really wasn't until I actually went through the training for a fitness competition that I saw that our bodies truly are made in the kitchen and they're shaped in the gym. So
I like
Marcy
that.
and Plant Chicks, we're here to plant-inspire women to get off fad diets and on a sustainable lifestyle. But the lifestyle is not just nutrition. That's a huge component of it, but it's also exercise. It's the community that we create. And I have to say, so Colin is a doctor of osteopathy, which is a DO, same medical training as a medical doctor. But you guys do some things a little bit differently in your training. And one of the things that I've noticed in you guys, I've worked in medicine my entire life as a dietitian in medical sales. So I've worked
Mm-hmm.
across different specialties and I've attended countless medical conferences. But it wasn't until I went to the International Plant-Based Nutrition Healthcare Conference and the American College of Lifestyle Medicine where we met Colin, that these doctors are the ones that really walk the talk and talk the talk and walk the walk. So it's really important. And literally, like when you go to a healthcare provider and they don't look healthy, that doesn't give me a lot of respect with them. And I'm grateful
Mm.
that I've got a lot of healthy doctors, but also you guys on Instagram or that I met through social media. I rely on you guys a lot. And I
Oh,
am very quick to like text you guys and say, I've got this going on, or I've got this question. And you guys are super, super helpful and super informative. And on your podcast, you share a lot of really valuable information.
thank you. Thank you. I really appreciate that and introduction. I think it's really valuable to me more so since the pandemic has started to, have had these introductions in person and to meet you guys face to face and so that because it's not just like a total stranger talking to, another stranger, so it's like, we have that added, value of meeting each other in person. So but yeah, I totally thank you for that. And us doctors using platforms on social media, we do our best, and I definitely have find it very valuable to kind of leverage it to speak as far as wide and as broadly as possible. And in my opinion, be more effective than the four walls than, when I'm actually counseling someone one-on-one. And so I want to be able to use the technology, leverage it as opposed to technology, seemingly using us, you know what I'm saying? So we could easily be distracted in this world, and all I see is people just in their phones all the time. And, I get it. But it's important to remain connected, especially during this time.
100%. And that's one of the things, connection and community is so important for overall health. Many of our personal followers on Plant Chicks, you guys know that I'm in recovery. And during the quarantine and pandemic, addiction has taken a lot of lives. People are drinking more, drugging more.
Yeah.
But I have to say, recovery has also amped up their game. I'm a part of a meeting that meets every morning at 8:30 a.m. And we were just talking today, like we're feeling super, super connected in a very disconnected time,
Yeah.
even though we're just meeting virtually. So if anyone out there is struggling just in life in general, it doesn't have to be with addiction, but just struggling, one thing that I really encourage you guys to do is reach out to one of your friends, call them, ask them how they're doing, or make an appointment with one of your healthcare providers to talk and see if there's anything that you should be doing in your lifestyle or possibly medications that you should be taking too.
Yeah, yeah, definitely. And I definitely want to piggyback and echo with that. And thank you for sharing that. I know that could be a very personal and vulnerable thing to share. But one of the main reasons why Jackie and I wanted to be on this IG Live was to really communicate to our audience members how to kind of optimize our health, through the winter season. Obviously, we know that COVID is, forefront, but we're also getting, we're in the flu season as well. And so, you hit a really good point in terms of, addiction. And then what I've noticed, the trends in the beginning of the pandemic was, people, staying indoors, and they're either becoming more anxious, more stressed, or more depressed. And so what happens is that we are emotionally eating, right? That's I gave a lecture series at my medical school alma mater about how food can also be an addiction, even though in the DSM-5, it doesn't actually, label that as such. But we know that substance abuse, we know that alcohol, they can be very addictive. But food can also be addictive as well. But in terms of, drug abuse and alcohol, we want to be able to avoid as much as possible. But yeah, food is definitely up there as well, because we have just created so many different things that our body is not, is insensitive to and intolerant to. And so we have to be more mindful of how we put these things into our bodies and what we are exposing ourselves to.
Absolutely. So can you dig deeper? Like, can we unpack that a little bit? Because food, I was actually just working with a sponsee earlier today, and one of the areas that she's wanting to work on is food, sugar
Mhm.
specifically. But I would love to hear some things that you might share with your patients about what they could do instead of turning to food to work on whatever emotion they're dealing with. And I'll share some of my thoughts too, if you'd
Yeah,
like.
yeah, yeah, definitely. So like one of the things that are trending, quote unquote, I don't want to use hashtags or trends or anything like that, but one of the things that I observe is that people are using things to improve their gut health, improve their immunity, just kind of singular quick things to be able to kind of get rid of this or ward off or prevent as much as possible. I would say before I even start that, I would say the best thing for us to do in general is prevention, rather than contract it and get the actual condition itself. Do our very best to be able to prevent it as much as possible. And the same way that, for those of you who don't know me, is that I advocate for a whole food, plant-based, lifestyle approach to be able to prevent, lifestyle related conditions like heart disease and diabetes and cancer and things like that. And it's interesting how when you look at the risk factors of how people with who are getting COVID, especially the older adults, 65 and older, is that when you have these risk factors and medical conditions like heart disease and diabetes, we have an increased risk of getting them, right? So there's a lot of, a lot of associations with it. And people of color, are also getting it in increasing numbers. And that has a lot of reasons as well, in terms of food access, food inequalities, just getting poor quality access to food. So there's a lot of reasons for that. But I would say in general, what I love about, speaking from a lifestyle approach is that it's one of, you can consider it as almost like a catch-all, So in the Western world, in modern medicine, we have created therapies to be able to treat, a pill for every ill, right? And in a lot of cases, it's very, very necessary. They're very life-saving, procedures are very life-saving. What I feel we do not of a good job enough is the preventions part, right? And so, this goes back to the question you were asking me before we got on this, what did I present at the conference, at the lifestyle conference this year? And, what I presented was using culinary classes, workshops to be able to educate medical trainees in the community. And it was a pilot study that we did in the inner cities of Baltimore. And what we found was that it increased the competency of cooking with residents, as time went on. Very, very small, study, but it highlighted the fact that in medical school and in our training, we don't get enough of this education. And so when you don't get enough of this education, doctors, educators are less confident to be able to dispense the education, right? Like you talked about how your observation was, when you see someone that is not befitting, that's not walking the walk or talking the talk, you're less apt to get information or to be able to receive information from them, right? And studies do show that we do turn to our healthcare professionals, doctors, for this information. Most of the time we are going to Dr. Google and doing these Google searches because it's quicker, right, than waiting in line, waiting in the waiting room. But a lot of people do rely on our healthcare providers to get this information. And so this is a catch-22 where if most of our healthcare professionals are not having the adequate education and so not having that confidence, they're less apt to dispense it, and that gives us as a healthcare system a disservice, and it also gives the patients a disservice. And so for me personally, having known this from even before as a medical student, I took it upon myself to, really take the extra, leap in terms of being trained as a chef, being, trained as a health coach, being, doing all these different things to be able to give that extra, for that patient, which in my personal opinion needs to be a standard. It needs to be a standard. So, but yeah, a plant-based, whole foods plant-based approach, and I'll go deeper. I just don't want to keep talking, is what I advocate.
Well, you've got a lot of really good stuff there, and I definitely want to talk more. So a couple of things that you said, three things. Prevention is so critical, but for any people who are coming into the flu season or COVID season, like the numbers are going up right now, if you already do have some other illnesses like cancer, diabetes, heart disease, anything, it doesn't mean that you can't stay safe and you can't get healthier even in this time. And one of those big ways is looking at the foods that you're eating. Like literally every single bite that we take, we have a choice. So are you going to choose like a fruit or a vegetable instead of, like, for a snack food, are you going to choose that banana? Or are you going to choose the cookies? That's a choice. And
Right.
we really want to encourage you guys to choose the healthier choice. And I have worked with hundreds, if not thousands of clients, and I've never had someone send me a picture of a banana or a broccoli stalk and say, is this healthy? But they will send me packages and ask me if this packaged food is healthy. So
Right.
we intuitively do know foods that are good for us and foods that might not be as healthy for us. So
Right.
literally every time we eat, I do encourage you guys to stop and think and ask yourself, is this going to help me and heal me? Or is it going to get me closer to getting sicker or possibly getting the flu or whatever? So Prevention is huge. Another thing that you talked on was food insecurities, and someone also commented in here, if you are in an area, or if you have lost a job and you don't have money and you're not sure where your next meal is going to come from, check
Hmm.
with your local government, check within, like, do a Google search and see, because a lot of communities are doing food where you can get food, like a food pantry. So there are foods available for you. So that's one of the things. And there was one other thing that I wanted to say, but now I can't remember what it was. But you had so much really, really good information. Oh, I know the other one was how you said that the study that you guys did, it was a small study, but when you actually have the tools, and you personally as a physician or me as a coach know how to describe how to cook or what meals to make, it makes a huge difference. And we did a retreat a year and a half ago, and one of the women who attended the retreat, she had just finished her master's in nutrition, and it was a plant-based retreat, and we actually presented it at the ACLM last year,
Hmm.
but as a poster. But one of the things that she said after attending the retreat, she was like, I had no idea how easy eating a whole food plant-based diet was, even though she had learned a lot throughout her nutrition education, but she didn't have the hands-on. And
Yeah.
that's why it's really important to start educating yourself and training yourself as a healthcare provider or as a patient.
Oh yeah, definitely. And I mean, there's a lot of points to what you just said, Jackie, as well, is that um, it's really the gap. There's a huge, huge gap in education and information, where not only do you have lack of the education, but with our social media age, you have a, overabundance of misinformation, right? And so that's the challenging part for, healthcare educators, to be able to kind of weed through all that and filter through all that. And so, one of the things that we're trying to do as, doctors using social media is to be able to kind of use our platform to be able to, say like, this is good, this is not good. But at the same time, with the caveat that, this really isn't meant for your go-to for, medical advice. I do want to make that disclaimer. And if above all else, definitely defer to your primary care, provider and educator as well. But yeah, I mean, general points would be, when I counsel patients, no matter where they're on the spectrum, whether they're a heavy meat eater or an extreme vegan. And everyone in the middle is everyone can, afford to eat more plants. And I just really distill it into 3 words because it's simple. You have to make language that is simple, very easy to remember, and, the language is clear, eat more plants. And the reason why is because, there's a mountain loads of research, which you already know, and we just, teach this and educate this, is that, real food that comes from Mother Nature doesn't have a nutritional, label, right? It's perishable, right? And it is stock full of vitamins, minerals, phytonutrients, antioxidants that help not only optimizing our health, but boosting our immune system, that animal-based foods do not have, right? And also fiber, right? And real food, this is the best way I, educate people is that and when you enter a supermarket, real food lines the perimeter of the supermarket, right? Because, and I asked them why, and 50% get it, yes, some 50% say no, they don't get it, is that's where refrigeration, exists, right? To keep food alive. Everything on in the middle is on shelves, right? And it's, quote unquote non-perishable, and we have to put all these different types of chemicals, preservatives, additives, binders to be able to keep it, sustainable, right? But real food doesn't have a nutrition label. Real food eventually, perishes, and we want that, either in raw form, cooked form, to be able to nourish our bodies with. And not only does that protect our immune system, and it optimizes our general health. So, but yeah, a lot of great points.
And I love what you just said. And I think this is one of the reasons we love you, because your philosophy is eat more plants. That's 100% our philosophy as well. And like you work with the carnivores to the extreme vegans. And the commonality with every diet is literally eating more plants. So that's one of the things. So that's a takeaway for nutrition, right? To stay healthy through the holidays and through the flu season, this
Yeah.
pandemic, eat more plants. And there's no one magic bullet. So there's not going to be like, oh yeah, mushrooms. You have to eat mushrooms all the time. Dr.
Right.
B always talks about, kale is amazing, but if you only eat kale, you're going to miss out on a lot of other nutrients that you need in your body. So diversity of plants is the number one thing that you can do. And the American Gut Project says to eat a minimum of 30 different plants every seven days. So every week,
Yeah.
eat 30 different plants. And if you're new, if you're like, holy crap, that sounds like so many, it really isn't. Just start writing it down. See how many plants you eat. And if
Yeah.
you don't typically eat a plant at every meal, try. Just try and have one at every meal. You got to start somewhere.
Yeah, exactly. And what you said sparked a couple of things in my head. And I remember way back when, Jamie Oliver, the British chef, he, made his first show episode in West Virginia. And this etched in my mind where he was showing just simple, I think it was a turnip, to a bunch of kids. I think they were first graders, maybe second graders, and they could not guess what it is, right? So you have that point where you have that big gap of seeing what's on your plate, but having a really, really, really large disconnect of where it came from, right? How it's grown, what season we're in, what part of the country we're in, right? There's a huge gap. And the second point was I interviewed a chef colleague of mine, and Chef Nina Curtis. I love her, and she told me that if we were to eat a fruit or vegetable, a new one for every meal. So if you say 3 times a day, if you eat 3 times a day, 365, you would not repeat the same plant, in the plant kingdom. And I liked how she phrased that because that's how diverse our plant kingdom is. It's not as, salad greens and a banana, apple, and oranges. There's just way more, you know what I'm saying? And I
Yeah.
would encourage people who are listening to not just go to your local supermarket, but if you have access to an ethnic supermarket, like an Asian market, an Indian market, a Mexican market, right? Like I live in LA, I'm based in LA, and so, we have a huge diversity of, different backgrounds and ethnicities, and hence their own respective stores. A wholesale club, looking at different, markets, you can see how diverse, our plant kingdom is, just as diverse people of color are.
Right. No, that's so true. You know what? Back in the days when we could actually travel, well, I mean, I know we can still travel now, but one of the things I used to love going to different grocery stores. Like even in Hawaii, the food in the grocery stores are very different. Costa Rica, Vietnam, it's really cool seeing the different foods, the different plants that people are eating across the world. So
Mhm.
yes, eat more plants. And I love that idea. We've actually done challenges before, like have a new food challenge, but it's
Mhm.
like try one new food a week, or usually it's one new food a month. I love it for every meal. That's a really steep
Yeah.
challenge. I love it.
Yeah, yeah. Or another challenge too is that, I like giving the 30-day challenge for, people that are more animal based or meat predominant, that, you can go back to how you were
Right.
eating before, but just give yourself a chance, of trying plant foods for 30 days. Have a food journal, write down how you feel, right? Tell me about your sleep patterns. Um, you know, let me know about your work productivity, tell me your recovery during training, anything at all. Just write down in a journal and see how you do for 30 days. Just give your body a chance. And what people, tell me is that, of course, everyone's different, but people tell me in general they gain more energy, right? They feel that they don't react as much in terms of emotionally. They feel less bloated. They feel less, swollen, less inflamed. Some lose weight, right? And so, I don't really get a very bad side effect or negative comment from eating more plants. Probably the only thing I can think of is, for those that don't use the kitchen a lot or don't cook a lot, they run out ideas, right? Or they just, can't come up with something and they feel like they always have to turn to, either something frozen or, so they'll do something that is in transition, right? Because we have a lot of Beyond Meats and things like that. So
Hmm.
more in transition types of foods or in transition type of cooking method before they can, be totally immersed. So 30 days to me gives the body and gives routine behavior change enough time to be able to, give it a chance. Because you and I both know that lifestyle changes is really the core of
Yes.
everything. And you need time. It took us time. I tell the patient or client that it took us time, for those daily changes to be able to get to where you are, the high blood pressure, the weight, the diabetes. It's going to need that much time to get out of that, if we want to reverse diseases.
Totally agree. Sorry, my husband's calling me right now. I need to let him know that I'll call him back. No, it's crazy, amazing how powerful just food can be. And I love your thing. Just try it. Give it a try for 30 days. And I also love that you have people writing down how they feel, because all of those side effects that you just said that you hear from your clients or patients are ones that I hear from our clients as well. And
Yeah.
they're always like more energy. I'm sleeping better. I'm more productive. So it's like positive side effects. It's really powerful. And this is actually how Marcia came to a plant-based diet. She was having kidney stones from eating a high protein diet for a fitness competitor diet or whatever.
Yeah.
And her dietitian said, "You're eating too much protein. I'm going to put you on a low protein diet." And a low protein diet was not a low protein. It's actually the RDA of protein. So she switched over to a vegan diet at the time. And she did exactly what you just recommended, Colin, is she's like, I've been on so many diets. Why can't I just try this for 30 days? If I don't like it, if I don't feel good, then
Right.
I can always go back to eating meat or eating more the way I was eating. But the thing is, she felt so amazing. And this was 10, almost 11 years ago that she did this. And she's
Yeah.
never looked back.
Yeah, and another thing to emphasize, you hit a good point, is listening to our body cues, right? I think we are really good in creating so much noise and so much distraction around us that we don't listen to our body. And our body is a highly complex, brilliant, system. And I feel like, we never know 100% of how our body works, and we're
Mhm.
getting there, right? But it's good training and good practice to be able to listen to ourselves and notice how we feel, right? And what I observe from my patients that stick with a plant-based approach is that they become more sensitive to foods that they used to eat, being more intolerant. So for example, for someone that's able to wean off of soda or Diet Coke or something like that, or processed foods and junk food, when they reintroduce it back into their system after like 3 weeks or 4 weeks, they get perceptively a higher response. Like something will taste, just really, really bad, or the soda will be super, super sweet. And that's your body adapting. That's your body going back to its normal quote unquote baseline. And you're just getting healthier, you know what I'm saying? But yeah, I mean, food is one thing, and I know you guys do a lot of, fitness. I see your videos and stuff like that. How has that, helped your clients, in terms of that approach, to optimizing, their health?
I'm so glad that was a perfect segue, by the way. Before I answer that, do you have like a cooking show, or do you have a YouTube channel where you like show cooking, like chopping skills or anything like that, where people can?
There's a lot of things in the works. I do have a YouTube channel. It is not as comprehensive as I, like. My forte so far is really being on the podcast. But
Which is
there are
amazing.
my forte is the podcast. I do have a lot of upcoming projects coming down the pike, so I will, let people know. But yeah, I definitely have resources I can defer people to. But yeah, it's it's upcoming. So
Perfect. Make it happen. And as soon as you do have more cooking shows and as soon as you start launching more stuff, let us know and we'll definitely share it. And you guys, Marcia does Meal Prep with Marcia on Amazon Live. We also upload it to YouTube. She said every Thursday at 1 o'clock Eastern, 12 Central. I'm going to start doing plant plates with Jackie on, I don't know what day. So we are going to do some cooking shows where we share recipes because one of the things you said, people, when they're starting to eat more plants, they kind of run out of ideas. So we literally, there's so many different
Yeah.
recipes and there's no shortage of information that's already out there.
Yeah.
How do you start for the first week? What would you tell a patient? Maya wants to know.
Yeah, I actually know Maya. Hi, Maya.
Yay.
So I would say, one of the things, one of the big resources that I use is Dr. Neil Barnard's resource, the Physicians Committee for Responsible Medicine, and they have a 21-day vegan Kickstarter. Don't be, afraid of the word vegan, but I would say I actually use that resource to start my patients, and it's a free resource in English and in Spanish, and they have a lot of videos, to get started. So I will link that when I post this video as well. Dr. Michael Greger, he doesn't really have shows, but he has great, resources for nutrition facts at nutritionfacts.org. We, both love his stuff. He's a great man. Um, let's see. For cooking recipes, I have some recipes on my website.